strange situation here in Manaus, but
Yeah.
let's go. Let's move on. So it's a great pleasure to have you here with us. We are all very honored for this, and I'd like to thank you again for this moment. And please be free to talk with us and to speak about clinical research and the goals of PPCR. And it'd be very interesting, and I hope that people that are here with us, that is almost 50 people here, I think that it'll be great for everyone. Thank you so much.
Beautiful. Thank you. Great to see you, Robson, and everyone. Pablo, let me see who else is here that I recognize. Denise is here. Just quickly, I don't see. Yeah, that let me. Carl is here. Anyway, there's some people here, but let me just go and speak. So, hello everyone. So again, glad to see you all. So the goal here of this meeting, this virtual meeting, was to, one, introduce the site in Manaus, and two, discuss a bit more about the course. One thing Alma and Robson told me was to talk a little bit about COVID research and how understanding more clinical research can help you with planning and understanding studies, COVID-19 studies. But anyway, so first, it's wonderful to have the site in Manaus. Robson is a good friend, so I've met Robson several years ago. So he and I we got trained in the same University of São Paulo. So I moved to Boston about almost 20 years ago. And then our paths cross again when one, he was interested in doing research in the same area that I do research, and also the second thing was that he was interested, and we were talking. I said, look, I'm moving back to Manaus, and I'm very interested in taking this training, the PPCR training. He did PPCR several years ago, and then he talked to me and said, look, I'm very interested to take this training to my colleagues in Manaus, to disseminate clinical research there, to increase research capacity in Manaus, as you know. And that was wonderful. So I was very happy with this collaboration, this partnership. We have trained a number of clinicians in different areas of care, medicine, physical therapy, nurse, and most areas in healthcare again. And what our goal is to continue expanding this clinical training program to other colleagues in that area. We think it's very important as well to enhance clinical research capacity. So one of the things, and you learn in the course, knowing the knowledge of clinical research is essential, not only, and I know it's obvious that it's essential if you wanted to design your trial, if you wanted to run a clinical trial, but mostly important, if you're also a clinician, so you need to know clinical research methodology. And why? Because you are the one in the front lines, you are the one seeing the patients, you are the one who has to translate the knowledge that you're reading the papers in your patients. So that's why it becomes essential and that's my passion as well. So again, I did my training in Brazil, as most of you know, and then moved to Boston. But during my training, so one of the things that for me was important was I felt that my training was not complete because most of the treatments that were available, at least the time that I finished my residency, they're not enough. The frustration that you have when seeing a patient and you cannot offer anything else. And one of the things at this point, so you wanted to go back, you wanted study, you wanted to learn more, what can you do to help your patient more? But in order to do that, it's not just going to PubMed and find the articles and reading the articles. You need to read the articles with a different set of eyes. And that's what we try to discuss in the program. That's what we do in the program. And we wanted you to finish this program knowing how to read a paper, how to interpret a clinical research article well, and have your sort of critical thinking on that, meaning that doing a good analysis, a deep analysis on an article. Of course, not all articles will be able to do that, but at least with the number of articles, you can do that. So we'll discuss more again. This course, it was, in a way, it was designed a little bit on my experience by being trained as a clinician, and then learning that I need to learn more about clinical research. And of course, I decided to become a scientist, and that was very important. So I used that in my research laboratory in order to design the trials, in order to review grants and many other tasks that you have to do as a scientist. But one of the things, I think my initial goal when I decided to go through this route, come to Boston, and I took some programs here. I did 2 masters in clinical research, one at the medical school and one at the School of Public Health. And I saw, again, after taking these 2 master's program, for me was clear that this is essential. Now, at least, again, I know it's a bit ambitious, but for me, most, and if not all, the clinicians should have this knowledge of clinical research, if not through PPCR, if not through the course that we design and we offer, through any other course that exists. One of the things you can say, look, but in medical school, I did learn about statistics, epidemiology. You did it, that's true. But when you're in medical school, you are, and that's one thing that I also discuss in another program that I run, is about teaching and learning. When you're in medical school, you're interested in learning, how to treat a patient. You're interested in learning about pharmacology and pathophysiology and so on. So surgery, obstetrics, you're not as focused as learning about the statistics, epidemiology, and even for you at that point is a bit abstract. When medical students in the second year, the first year, have to learn about statistics and epidemiology, it's difficult because, in a way, it becomes interesting for you when you know how to use that. When you learn in medical school, it's a little bit abstract. So that's why I think that things are a little bit, the order, it's a little bit tricky as well. So and the way that's given, it's not as optimized, and that happens not only in Brazil, but happens here in US. When medical students come to work with me, I had medical students from Harvard. I have residents from Harvard working in my lab as well. It's same thing as well. They don't have all the knowledge that they're supposed to have it. So again, that's my passion, and that's how we designed the program. So can we offer something that I had here in Boston to students all over the globe? Was initially in Brazil, and then we expanded as well. And the idea of the sites is very important. So the sites, one helping each other. I know during the pandemic and the whole last year, and I know it will be a few months this year, maybe until summer, maybe even later, hopefully sooner. But anyway, of course, the sites will only open when it's safe to be opened. But if you can enroll in a site, if you're in a city that has a site, please do so, because we wanted to keep the students connected. That's an important thing as well as you go to the program. And one of the things that I wanted to say as well, this program was designed not to pass the content only. This program was designed to truly have a you are in the center, meaning you are the protagonist. It's not me, it's not the other faculty, it's not even the teaching assistants. You are the protagonist. So, and that's how the program was designed. Okay. And then, so one of the things that before I pass, and I wanted to hear the other colleagues as well, so about their experience. We have some chase here, we have some alumni from last year, and I wanted them to speak, and I wanted you to ask questions as well. So one of the things that Robson and Alma, they asked me to talk a little bit about COVID-19 and research. And again, I'll just talk a few words about that. And I think it's obvious how clinical research has been essential for us to understand this pandemic, for us to understand the transmission, for us to understand methods of prevention, for us to understand therapeutics. So you've seen, again, the big political discussion still happens with some of the medications. Some of them, they have no effect, and they may even have actually a detrimental effect, such as chloroquine. And that study actually was a good study from PPCR alumni as well, who published in New England the chloroquine study, showing that actually the drug can worsen patients' outcomes. And that's one thing that, again, it is important for all of you. And one thing as well that it was interesting during this what happened in COVID, because everyone was interested. There was this political discussion. It's important for you to go there, to read the paper, to see how it was done. Is there a possibility there was a bias? Is there a possibility the results are not valid? And you need to have that knowledge. Okay? And of course, the final thing is about vaccine and understanding how to read the results from the vaccine. And I know in Brazil there's a big discussion as well why the trial in Brazil of the vaccine from China was different from the trial that I think the trial done in China, and the population was one of the issues. But again, all of these, it is important, because otherwise you just rely on other people doing the analysis. And it's important that you do the analysis yourself and you understand how it is done, how it is research is conducted, and you can do your analysis yourself. Okay. Yeah, and those are my initial introduction for the program. We are very happy. Again, the program becomes it's interesting. So I started this program in 2008. It was with a site in São Paulo, USP São Paulo. There's still a site. My good friend, Dr. Vo, who runs the program, and we start growing actually throughout the years, even more than we expected. Initially, it was just meant to be a course, and then it started growing, and now we have this big global program. And again, the goal is to continue growing the program, and because we know that we believe in the mission in the program, which is to truly get participants to finish the program and being able to truly understand methodology, to read a research paper, to design a study, to run a study, to do an analysis. And that's one thing that I always tell. So one of the things that's interesting, so we are a bit ambitious on the goals of the program. We teach you statistics, we teach you clinical trial design, we teach you basics of epidemiology, how to write a manuscript. So we really have a comprehensive program, and that's our goal, because we know that in order to become a successful researcher, in order to understand well, you need to understand the steps very well also. Okay, and yeah, so that's my brief introduction. If Alma wants to complete, and if there is any questions as well for me, happy to. And I think I started and I forgot to give a little bit more, tell a little bit more about myself. So again, I did tell that I did my training in Brazil, medical school at USP, residency as well. I did my PhD also at USP, but the PhD was both places, here in Boston and also there in Brazil. So I went back to defend my thesis and then came back again. So, and then I came to Boston for a postdoctoral fellowship, as I mentioned, at Beth Israel, one of the teaching hospitals here at Harvard. I stayed and became faculty, did all the levels of faculty position. Now I'm the final level, it's a full professor at Harvard Medical School and Harvard THN School of Public Health. I have appointments in both schools. I run a research laboratory, the Laboratory of Neuromodulation. It's a large laboratory now. Actually, we have a little bit of restricted team because of COVID. Many of my fellows had to go back, had to go to other places because of the pandemic, and still the borders are closed for many countries here. But anyway, so that's my day-to-day actually life is to run my research laboratory. I have grants for NIH, grants for other places, and that's it. So some of the one of the things that as well that it is not part of the program, but some of you after the program decided to do masters in clinical research, masters of public health, and I'm happy to help as well. We have about, I think, 30 or 40 PPCR alumni who applied for the masters this year, and hopefully many of them will get accepted. Some of them, they come for fellowships in my laboratory or in other laboratories as well. Happy to facilitate on that. So the idea of PPCR and a good number as well become teaching assistants for the second year, which again, it's optional. It's not part of the program, but that's something that it is a nice thing. So with that said, let me not take the full hour of this meeting. Let me pass to Alma, and let me see if we have questions from colleagues.
Thank you, Professor, for your time and for joining us today. We know that you are really busy, and we appreciate that you are here. Then Guillermo Arias, I have one question for you. He said, "Do you think that the pandemic has shown us the importance of understanding more clinical trials? Where is the fault? Do you think the university need to introduce more clinical trials in their course?"
Good question. Is Guilherme? Yes. So, good question. So, and that's one thing that I discussed as well. So, is it, Guilherme? So, do you think it's I think here, Guilherme, I think there is a main issue here with and that's why I'm another passion that, again, this course is a passion, and then my other passion is about education and learning, and that's in a way it's a little bit what I do research in my laboratory on learning, but learning after neural lesion during rehabilitation. But anyway, so Guilherme, I think it is just difficult. So one of the things that I see in medical schools in general, not only in Brazil, but in other places, the system is still a teacher-centered type of education, meaning that the learning is not centered on the students. The learning is centered more on the teacher. So basically the teacher goes there, give the classes. Sometimes you have some discussions, some exercises, but it's more based on the teacher. So what I'm trying to say, what happens is that there is a general lack of motivation from the students for the topics that are taught in medical school. So, and in the end of the day, the students they get motivated because they know they need to learn the clinical, especially clinical specialties, which again, cardiology, neurology, pediatrics. So there's an intrinsic motivation to learn that. I think the issue is not as much as universities not offering clinical research, good clinical research courses, but the students, the way these courses are designed and are given in the medical school. So one of the things that I also think, Guilherme, so is that perhaps the timing they are given, but I still think it's not only the timing, because we do have sometimes second-year students in the course. They do great, they learn a lot, and I'm sure they wouldn't learn on their courses in the school. I think it's a general, again, issue with teaching and learning in medical school, and therefore things that are not perceived by students as something essential, they just don't care. And the difference is that the population that, the students that come to PPCR, they understand they need to learn that. Therefore, they're more motivated to take this course. So again, I think it's, that's why the webinars like that help you guys to understand why this is so important. And how to change that, it's a difficult thing. So, and yes, if there are more, then likely, perhaps there'll be more education of physicians, there'll be more clinical trials, maybe that could even affect some of the outcomes that we saw in the pandemic. Maybe it's difficult to say.
Great, thank you, Professor. And then we have one more question from Micael Oliveira. He's asking you, could you comment on how to minimize bias in the interpretation of research results? This is because in science itself, there are contradictions between the articles.
Yeah, good point. In terms of, again, so the one difficult that you learn as well, it is, Micael, bias. It's, that's why you need to learn deep in order to understand how to identify potential bias and identify how that could affect the results. Bias is not something that you're going to, the articles, if you read that, you can go there and say, oh yeah, I can see bias, it's here. Some articles, it's clear. Let's say they do a clinical trial and you're asking the patients if their pain is better after the treatment, and there is no placebo. No, likely there is what you call assessment bias there. So participants, if you give something to participants, they'll feel more relaxed, they'll feel less pain, or the evaluators, they you just judge they have less pain and so on. So I think some cases are very easy, but in most of cases, bias is something that is difficult to be identified. Okay, same thing when when we are thinking anything we are doing, there's likely some bias, some errors of processing. And why this happens, there's a very good book. It was the Nobel Prize, Daniel Kahneman, and he discussed that in his book. It's called fast thinking and slow thinking. Basically, discussing two systems. So basically, we do have a fast processing in order to make our life a little bit easier and functional. And because of that, we are subjected to thinking biases. Okay, so and that's similar in research as well. So in research, biases are, in a way, are hidden in the papers, and sometimes you see, look, there's a potential for bias, but you can't say for sure. And that's one thing, and that's why it's difficult. That's why you need to learn deep in order to understand and to identify. And that's why, again, you always have a level of uncertainty when you're reading a clinical trial, okay? And that's an important thing to learn as well, that is not black and white, okay? And sometimes a lot of people, they say, things are, you should take this drug because this drug causes X, Y, and Z. And the reality is that if you only have 1 or 2 or 3 trials, you don't know. So there is too much variability. There is so much, again, potential biases in any given trial that gives you some level of uncertainty. So, and then again, that's an interesting question we'll discuss more in the program. Okay.
Great, thank you, Professor. And then because we're running out of time, we have Pablo Cortez, who was one of the top. Sorry, so because we're running out of time, we have Pablo Cortez, the PPCR alumni from 2020, one of the top students in the whole program. I'm really honored to have him here. He's part of Manaus Site, and he will talk about his PPCR experience in the program. Thank you.
Hello. First of all, thank you very much for the opportunity of being here, Professor Felipe and Alma. I'm a physical therapist. My name is Pablo Costa Cortez. And yes, I was a PPCR student last year. And I can say that it was one of the most amazing experiences I ever had as a student. And however, I, like many students, had some reflections and concerns before doing the course. Of course, we all are concerned with the English aspects. Most of us, we are not native English speakers. We are going to do an online course, although I already had done some online courses, my development had been greater in in-person courses. And what did I face when we started the course? Well, I can say to you that I faced a team of TAs very well committed to the students' development, and seeing all the care and all the effort, it helped me to understand that I was in a safe environment to learn and also to make mistakes, especially. Yes, PPCR is a very demanding course, and it requires a lot of hours of study and commitment, but helps you to develop the critical thinking, as Professor Fregni was saying. And in my opinion, these last words, critical thinking, is something that everyone may talk about it nowadays, but how to achieve it, it's the big game changer for education, especially if we consider an online course as PPCR is. And for me, this is the differential of PPCR. The course knows how to apply methodologies based on neurosciences and to stimulate the students' learning process. I mean, human beings learn from communication, and this course focus on the interaction between the students and how can we learn with each other, with our experiences. A question that I used to question myself, it was, how can I apply all this amount of excellent knowledge I'm receiving now? So I can give you now the perfect example. That is the COVID-19 pandemic that we are living in. And indeed, we can apply the importance of courses like PPCR in this current situation. We are gaping with so many health misconduct and atrocities by several governments across the globe, and health actions could be taken to avoid the virus dispersion and vaccine predictions and so on. And it's my opinion, but help to educate the society is challenging, but it's a duty to every researcher. And exceptional clinical research helps to shape our society and to create a better future. So to everyone that I know, I say, do you know PPCR? Do you know PPCR? Because I recommend it for everyone that I see. And I believe that every professional committed to the growth of your profession should take PPCR course. And it could be for clinicians, it could be for researchers full-time, and so on. It's for everyone. So this is a brief of my little experience that I had, and I hope that it contributes to our talk. Thank you.
Thank you so much, Pablo, and we're really honored to have you and to be part of now. I know that you're trying to be at TA this year too. And yes, PPCR, we truly care for your learning. And not just that, we also care for you to keep growing in any path that you're going to follow, even if you're going to be a clinician, or if you want to follow the clinical research area and field, or if you want to keep working in your country in research. We have many activities and the networking that we do, because we believe that we're a family, a really big family, a worldwide family. And yeah, so we keep growing. Right now, the students from last year applying to BTA1s for this year. We have many that are applying for residency. Many others are applying for the MPH right now on future years. Other ones for the PhD. And yes, the community has to be together to make these big changes happen in the world. So, and thank you, Pablo, for your kind words. And now we have, I don't know if Robson or Tatiana want to talk about Manaus Site and present their history.
Robson or me?
Hello, Tatiana.
Hello.
Do you want to talk first, or what do you prefer?
Yes, I can talk a little. I just brief words. Hello, everyone. Okay. Thank you for Professor Fregni, Alma, to visit our site here in Manaus. We are very happy because of this pandemic. So this time we need to use clinical research because it can save lives. So the safe information is the most important thing now. We have to read the paper. We have to, as Professor Fregni told, have a critical think about the information, if it's applied or not. And I was a PPCR student in 2019. Yes, and it was a marvelous experience. I want to say hello to Denise, that was my TA2. Very happy to see you here. And Vahid, Mariani, that is for my group, lead group 14. So it's very good to see you. I have a lot of learning. I was already involved in research, but with this course, I improved it so much. So I was a person before the course, and after I was much, I don't know how to express, but another person. I think sometimes we think that research is a simple thing, that's just to have the paper and everything is okay. We have to read the paper with a critical thinking. So sometimes an observational study can be even more than a clinical trial, depends on the quality of the study. Of course, that clinical trials, randomized clinical trials, the gold standard, but sometimes there are not good clinical trials. So we already have to have this interpretation. In COVID times, sometimes it's not possible to do clinical trials. So sometimes we have to balance the situations, the pros and cons, advantages and disadvantages of the studies, and to create our own interpretation. Unfortunately, we are with a very bad situation in the world, especially in Brazil, and especially in Manaus, because Manaus is in the worst situation of all Brazil. And I'm passing to this in my family. I have my parents with COVID. My mother was not good, but I don't know if I will be here because we'll talk about that, and maybe my emotions could be involved, but I'm here because it is not just important to talk about the course, but to talk the importance of this information of the course. Based on that, I'm doing my best to try to direct what the decisions that we are making. Because if you just trust, like with a blind way, we can have a worse situation. So I have to try to save my family, because we need to have critical thinking, and sometimes terrible informations that people are believing, and it's not good. So I'm very happy to say that my mother is better now. I was looking to my cell phone, and it's just to say it's a, because everybody is involved and there is a polemic about that. So the importance of a course like PPCR, it's extremely necessary. People need to know that science and clinics are together all the time. Both of them have the importance, but they need to be together. So this is what I want to say. And I'm very happy that we have this course here. So thankful for this. Robson is marvelous with us, and Professor Fregni, Alma, Sueli, all PPCR team. So what I can say is that if you want to be a serious researcher, serious clinician, PPCR is perfect for that, because we discuss. And another thing is the networking for people all over the world. So you open your mind about everything. And I think this is amazing. It's awesome. And also to improve our English, because all the course is in English. So you have to improve your English. Networking, English, and the learning that is huge. And we have the 5-day immersion course that was in Guarujá, São Paulo. It was amazing, because we are all the year talking with colleagues in the forum, in the river, in the lectures. But see the people in person, it's awesome. I don't have no words. So it was very good to find my colleagues in person in the 5-day immersion course. Unfortunately, this year it was online because of the pandemics, but I already met some people there. It was very interesting. Carla Lois is here, so I was helping them because I have the experience to be a site monitor here in Manaus this year. Hello, Carla. And it was amazing. I was very happy to be participating for this edition of 2020 and online. It was also great. And I hope this year I intended to be a teaching assistant, and I hope that I will be in the 5-day immersion course to see everybody all over the world, to talk. And this is the spirit of PPCR, to be a family and with the knowledge as the most important. So thank you so much for this opportunity.
Great talk.
So go ahead, Robson. Sorry to interrupt you, please.
Oh, no problem. Thank you so much, Tatiana. Thank you, Pablo. I'm really proud of you, all of you, and this was a great opportunity to listen to Felipe, to his thoughts about this course. And as you can see, PPCR change lives, improve your English, and save lives. And just going back to our history, I'm alumni from PPCR from 2011 class in São Paulo. Then I moved to Manaus in 2016. And after talking with Felipe, I really wanted to have a site here in Manaus in order to improve our body of clinicians dedicated to clinical research. And then with the help of my great friend, Professor Antônio Bochá, that is our Monitor Site with Dr. Tatiana, and with his help, we could set this site here in Manaus in 2018. I just want to share a little bit. Can I share my screen, Alma, just a little bit, just to show our alumni from Manaus?
Yes, of course. Now it is open. Sorry for that. I can't do it now.
Just to show our PPCR family, it's just a great pleasure to have all of this now researchers. So we have here Pablo, other Pablo, 2000. This is the class of 2018. Luciano is a cardiologist. Giancarlo is our TA. Mark Valdivia, Antonio Boixá, Luciana, Isabel. Luciana is our TA also. The team from 2011, 19. We have here Maria Caroline, Mary Carol, Tatiana is our site monitor and TA, and Heron, Francisco Heron, who is now, I don't know, I think he's now in Europe doing clinical research. And here we have Pablo, Thaisa, and Moises Cohen from our 2020 class. Thank you so much for all of you, and I'm really proud of you. Great, that's it. And I hope that you have enjoyed our webinar. And thank you again, Alma, Felipe.
Great, thank you, Robson, for showing. It's really nice to see all the pictures of all the alumni. You have a wonderful group every year, and they're really strong and together. They're always really together. Tatiana always comes to us, and we also remember Tatiana and her wonderful work during the 5 days in the manuscript writing workshop, especially, and with Professor Donna, how she worked with her paper and her amazing input in this. So I will talk quickly about PPCR, just for the people to understand what we do and how do we work. So basically, it's an online program, as you know. It was designed online. So that was a blessing for us during the pandemic, because we could actually deliver all the activities online, and your learning wouldn't change. Like, all is designed by Professor Fregni, and in a way that you and all the students can get a really well and deep knowledge. Like, you will relate the content of the week to your current work, to what your colleagues will show you, because imagine you will be with people from all around the world, everyone in different fields, everyone in different experience. Like the surgeon will learn from the pediatrics, and the gynecology will learn from the internal medicine, and things like that. How the techniques of clinical research vary among all these fields. And for example, what about the regulations? Like, they can change from in between Europe and Brazil and United States, and things like that. So it's a great collaboration where everybody's sharing and learning all together, like you are never alone. And the whole program has 5 models. Well, we of course have Professor Fregni, our mentor and professor who begins us. He was already talking to you. And then our 5 models are designed to start from since the beginning: how to design a research question, how to define your population. What about what could be the best study design that you could use according to what you're looking for? Because that's also really important, that you have to align the objectives of your idea to the best study design, and what could be the best outcome and how that has to be measured. All that you will learn, and then we move to auto models for statistics. I know that most doctors are afraid of statistics, and but we also begin with the basics, and we also develop a book. Yes, I have it right here. It's a PPCR book. The professor started in 2012 with this, to write this book where we present really easy cases with different scenarios, and for you to understand what could be the best option according to what is the goal of that study. And you will learn that in PPCR there is no wrong. Everything can change according to what you are looking for. And everyone can jump in the discussion, and you will learn from, maybe you were thinking that the best option is option A, but then your colleague come and say to you, look, Alma, maybe the best option is B because this and that. And that's how you learn, and that's the beauty of PPCR. And we try, because there are many other books, like, I don't know, other ones that are really heavy if you begin to study with, like, for example, this one. And when you're starting to begin with clinical research is, sometimes there are a lot of concepts that you cannot manage, and it could be hard and overwhelming. And here we, and the faculty and professor, everything is selected for you to try to understand it from the basic and to move on. And you can even go, we put required readings and even optional readings if you want to move on and keep studying about the topic. but it's not that we're going to give you like the hardest things right now and you will be lost. And besides that, we also go a bit besides statistics. We go over special study designs. Of course, you're going to manage sample size calculation. That is something that most of the clinicians doesn't know how to do, and that's really important because that will give you the power of your study and how to achieve it. And that's really important to know how to calculate. And then we'll also do regression meta-analysis, of course, because as you know, meta-analysis is also really important in clinical research. It will give you a great amount of information if you do it properly, if you select the studies to be included in that analysis properly. And then model 5, we'll go over observational studies, and you're going to compare that to randomized clinical trials. And just like Tatiana said, and she learned in PPCR, an observational study can sometimes be stronger than randomized clinical trial. That will depend on how it was designed and what you're looking for again. And the program is 9 months, as I said. We have a break during July. We call it July break, but actually you're going to work in the group project. And for me, the group project is the main activity of learning in PPCR, because in it, you're going to develop a randomized clinical trial protocol with your colleagues from scratch. You will have to select the research question with your group, and you have to develop everything. What was going to be the study design? What's phase? What could be the best randomization strategy? How you're going to select that population? How to narrow that population? What could be the criteria? And then how to do the sample size calculation? What would be the analysis? So all the protocol is created together. It has to be a real protocol. It is based in the SPIRIT guidelines. We also follow the CONSORT guidelines for this. And it's really nice. You will apply all the concepts that you're learning with your colleagues in that time. And then at the end, as Tatiana said, during the 5 days, you're going to work with Harvard faculty. All of them will come to you. We'll travel in Brazil, or if not online, hopefully, and we pray that this year will be easy on everyone, and we can find the best way to treat and prevent COVID and with the vaccine, right? We're really hopeful for this. But if we can meet, you will meet also the professors, Harvard professors, who will review your protocol in detail and give you direct feedback so you can polish and learn from it. Imagine receiving the discussing with them, why do you choose that strategy? And they come back to you and say, like, maybe it could be, this could work, or this is okay. How do we change this? How can we improve this? And having the research experience just there to you, and being able to talk to them and discuss with them and learn from them, for me, was really priceless. The 5 days immersion course is not mandatory; it's optional for the people, because we got this question a lot. What about if I cannot travel to Brazil this year? If you cannot do that, you can always do the individual project that is announced during the year. Currently, the price of the program, I believe, for the main program is right now, if you're on a site, is 3,000. If you're a web student, it's 4,400. We know that sometimes this price is high for all the countries because of the economic and how all the big hardship that is happening worldwide. But Professor Fregni just tried and fight against the university to keep that price low. It has been the same price in the last 5 years, thank God. But believe me that I know that it's hard, but it will be like the best investment that you can do. We truly believe that PPCR changed life, and we truly believe that our program, besides having Harvard faculty and all this well designed, the core, and I believe that is true, is the teaching assistant. We have a teaching assistant who will follow you since the beginning of the program. I will give you support all the time to enhance your learning and to help you grow. You can come to them by email. Their office hours on Wednesday and Saturdays, where you can talk directly to them, connected in Zoom, where they're waiting for you to help you out with any doubt that you got. And then on Tuesday we meet, right, during the live lectures that are from 4 p.m. Boston time, that I believe will be 5 p.m. in Manaus. And then on Friday morning, we also have the optional lectures that we go on Friday, that is the same topic that we have on Tuesday, but it's more a practical exercise. So the TAs, this is done by senior TAs that have been in the program for more than 3 years. It's a really well-designed lecture where they will present practical examples of about what's being discussed. So for example, if you're doing sample size calculation, the TA will show what could be the options that you got, if you're going to use mean, proportions, and things like that. And it's really great. So I totally recommend it. If you have any doubt, I'm going to add my email here. I know that we have great ambassadors of PPCR program connected here right now. Thank you for your time. But yes, and if you cannot do it now, I hope that you can come back in the future. But it's thoroughly worth it. Me, myself, I took the program back in 2012, and I can change you that it changed my life a lot. It opened my mind. I knew that clinical research was something that was lacking in my training, but once in, I just couldn't believe how much learning I was getting the all the knowledge from the faculty and the teaching assistants and all my colleagues, like keep discussing on all the topics that were happening back in that time. Yes, so I don't know if you have any questions right now. I'll be happy to answer. If anyone wants to open the mic or type it here, I'll be really happy. And thank you, Robson and Tatiana and Pablo, for being here. It's really amazing to be in your site, even though that is online. Hopefully we can travel soon and get the opportunity to visit you as we do during the year, during regular years. Any questions? I'll be happy to answer and help. If you don't want to open the mic, I can even, oh, I didn't present myself. I'm really sorry. I'm the education consultant of the program, also Associate Director of Education, and I'll be glad to help. Anyone? Yes, some people say that, yes, it's Harvard. Harvard is tough on you. But if you do the required activities that we have, you will learn a lot. And so people just go beyond. People just keep coming and they keep posting every week. You know? So that would the learning depends on you and how much you want to keep growing. So, but all the activities that we got, the required ones, just the required ones will make you grow a lot. Trust me that we do. Oh, we have Antonio here too. Hi, Antonio, welcome.
Hi, everyone.
Hi, welcome. I would like to say some words. It's really nice to see you.
Thank you so much. I think Pablo and Tatiana and Robson actually speak a lot about PPCR, especially here in Manaus. I just would like to say that it's a very important program for us here in Manaus since 2018, and especially for our PhD program in basic and applied immunology here, because many of our students is now engaged in this PPCR. It's very important to training our professor and also our students in clinical trial research. It's very important. And just as it, thank you so much for being here.
Great, thank you, Antonio. It's really nice to see you and have you here. Thank you. So everyone, any questions, please don't be shy or type it here.
I have a question.
Sure, go
Just
ahead.
a minute. Are you going to extend the period for applications like you did last year?
So right now we have the deadline for January 31st. We're trying to manage with the university to extend it. They just came from vacations. They were on vacations, but we will let you know. But if someone needs a later deadline, please send me an email so I can help and we can mark in the system that this person probably will apply late and we will help. Of course, we will help.
Okay, thanks a lot.
Sure. Anything else, guys?
People are a little bit shy here.
Don't be. Also something that they ask, oh, I don't know about my English, like I'm shy. PPCR, 90% of the people here, we are not native English speakers, okay? So don't be afraid. You're not required to talk fluently during the lectures, and everyone is here to help you out. Like you will see, all of us are learning together, and it's a really inclusive and caring environment. We're not here to judge you. That's the beauty of our program. Like we're like that, all of us, and you will see. And I hope that you enjoy it and don't be shy about that. We don't ask for TOEFL before. We used to, when I enrolled in PPCR, they used to ask for it. Now we don't. We just require like average writing and speaking skills. We don't want the top, a master in English to come in. So don't worry about that and don't be shy about that. You have to read. That's true. We put 3 required articles sometimes and then 4 optional, plus the reading of the book that is probably 10 pages, 15 pages according to the, but it's a small book and the letter is not that small. Also, something that happened to me is that I learned a lot of the medical terms and clinical research that I didn't know. Like I knew them really well in Spanish, but in English, I was like really lost at the beginning. And that's something really nice because yeah, you will learn here English, of course, clinical research, time management skills, leadership skills. Like some people enter here really shy, and when the group project comes, they just are like directing everyone, like, can you please help in this section? Can you please do that? And everyone. And then we also became educators, right? Because we applied to be a teaching assistant. If you want to, you become a teaching assistant of the program and the university, and you learn how to help, how to enhance the knowledge to the students, how to support them, how to provide a really important feedback. So there are many things that you will learn here, and I hope that you can join us and also be part of our family. So thank you all, and I have how many countries? Okay, so last year we got 62 countries. I'm really proud of that. 62 countries and 49 sites. The previous year we got 56 countries and 53 sites. Yes, a lot of people. Were all of us, and we put all the flags in the 5 days. It's like zero, all of them together. It's really amazing. People from all around the world trying to learn and work together, and we keep friends. We develop friendship here. We do. Something else? PPCR. Oh no, yes. That's really true. Imagine, and our great ambassador Tokyo Ueda, site director of Japan. She's amazing, and she always come and every time she travels, she asks for TAs or PPCR alumni who are in that country just to meet them and talk to them and help them. She's a really great researcher in Japan, and she's really connected, and she always tries to. How many hours do you sleep? Okay, that's a joke, but yeah, I do sleep. Okay, everyone, thank you. And for the TAs that are here, good luck on the workshop that is beginning right now this week. We're going to see you on Friday in the meeting, and have a nice night. I put my email there. Please feel free to ask me anything about applications, program, content, activities. How do we do grading? If you want to know about the grading, everything, I'm here for that. Have a nice night, and thank you.
Thank you, everyone.
Thank you.
Thank
It was
you,
a
everyone.
pleasure.
Thank you, everyone. Bye-bye.